Joshua, we've had a wonderful dialogue with you and your team and other experts around the world on this pandemic. We have learned so much from you, starting in, I guess, the vicinity of February and the permutations of April and May. If I discard a second wave and third wave mentality, and I simply look at the burgeoning cases, how do they fold over to an expectation of deaths to come?
Well, it is extremely concerning because it's obviously not just cases we're seeing. We're seeing a lot of people in the hospital. I was just looking at the stories about field hospitals being built in Wisconsin and other states, Texas asking for the use of military hospitals, Utah sending patients all over the country because the hospitals are full. Those are really concerning signs. Anyone who thinks that this increase is because of testing is completely wrong, because we're seeing these surges in hospitals. And with surges in hospital care, we're going to get surges in patients that need to be mechanically ventilated. And when that happens, there's going to be an increase in death. Now, the rate of death, meaning of the people who are that sick, we can take care of them better. Fewer are going to die. But that means overall, because there's so many cases, more and more people are going to die. So it's really cold comfort that there's a little bit of a less chance of in any individual dying. There are just so many more individuals. So this is a really serious time, and I think the projections that we could go from 1,000 to 2,000 a day are not unrealistic.
Do you have an extrapolation to the number of deaths out there? That's the one thing I couldn't find this weekend except from punditry. And on a medical basis, looking at the literature, can you extrapolate out the number of deaths in the United States?
I mean, that's not something that I do, but there are people who do those kinds of models, and those are the kinds of models that some of the pundits are citing. And so, based on the anticipated spread, Tom Inglesby from the Johns Hopkins Center for Health Security was quoted over the weekend saying something which I think is true. The cases are going up, and we're not really doing that much to bring them down. So we're going to expect them to go up for a while. And when that happens, more people will get sick. And that's what's driving those projections, that more and more people will be dying.
Joshua, when you look at the race to the vaccine, there are a couple of things that moved over the weekend. First of all, we understand that AstraZeneca vaccine actually makes an autoimmune response in the elderly. We also understand that J&J, Johnson & Johnson, said the first batches of its shot could be available as January. Is this much needed good news?
Yeah, I think there is some good news out there, and I think the evidence that the vaccines can create an immune response in the elderly is a good step. We don't know for sure that means people are protected. That's what we're waiting for the studies to find out, but the studies should be reporting soon. So, I think that's good. I still wish that we were learning a little bit more about what was going on with the trial from regulators around the world, but hopefully they'll be able to find their voice as these trials come to a conclusion.